Hello, my name is Dr. Richard Pratley. I'm Medical Director at the Advent Health Diabetes Institute and the Translational Research Institute for Metabolism and Diabetes in Orlando, Florida. On behalf of my co-authors, I'm very pleased to present our poster entitled The Efficacy and Safety of Low-Dose Semaglutide Once Weekly versus High-Dose Dulaglutide Once Weekly in patients with type 2 diabetes. This is a post-hoc analysis of the SUSTAIN-7 study. Now, you will recall that the SUSTAIN-7 study was a comparison of semaglutide versus dulaglutide at low doses and at high doses. At 40 weeks, we compared the A1C lowering at 0.5 milligrams of semaglutide versus 0.75 milligrams of dulaglutide, and 1 milligram of semaglutide versus 1.5 milligrams of dulaglutide. In that study, what we observed was at both the low dose and the high dose, semaglutide was superior to dulaglutide in terms of lowering hemoglobin A1C, as well as lowering body weight. Now, when we completed that study, many people ask us, what is the comparison between the low dose of semaglutide and the high dose of dulaglutide? This was not a pre-specified analysis, but it makes sense clinically. Many people in the clinic would be interested in what the effects would be if we switched somebody from dulaglutide to semaglutide. Now, that wasn't studied in this particular study, but what we are able to do is compare the safety and efficacy of the low dose of semaglutide to the high dose of dulaglutide, and that's what this post hoc analysis attempted to do. In this analysis, we looked at 300 patients in both groups approximately, and both groups were very well matched in terms of their age, their BMI, as well as their baseline hemoglobin A1C, which was between 8.2 and 8.3 percentage points. Here are the main results of the paper. We found that at 40 weeks, low-dose semaglutide and high-dose dulaglutide had equivalent reductions in hemoglobin A1C, 1.5% and 1.4% respectively. However, body weight change was greater with semaglutide than it was with dulaglutide. At 40 weeks, there was a 4.6 kilogram reduction in body weight on average in patients on semaglutide versus 3 kilograms in patients treated with high-dose dulaglutide. Not surprisingly, the proportion of patients achieving A1C targets of less than 7% and less than 6.5% were similar in semaglutide and dulaglutide treated patients. However, the proportion of patients achieving a weight loss of greater than 5% and greater than 10% were higher with low-dose semaglutide than they were with high-dose dulaglutide. Semaglutide and dulaglutide had equivalent changes in both systolic and diastolic blood pressure from baseline to week 40. They averaged about 2 to almost 3 millimeters of mercury for the low-dose semaglutide and high-dose dulaglutide for systolic blood pressure, and there was no significant difference with diastolic blood pressure. Turning now to the adverse events and the safety and tolerability. What we observed is the proportion of patients experiencing adverse events was similar in the low-dose semaglutide and the high-dose dulaglutide treated patients. This included serious adverse events leading to premature treatment discontinuation, as well as GI adverse events. As expected from this class of medications, the most frequent adverse events were GI adverse events, including nausea, diarrhea, and vomiting. The rates of nausea were very similar between low-dose semaglutide and high-dose dulaglutide treated patients. We conclude, therefore, that low-dose semaglutide showed greater weight loss but equivalent reductions in hemoglobin A1C compared to high-dose dulaglutide in this particular study. This has clinical implications in that we can then adjust our treatments accordingly if we wanted to switch patients from one drug to another drug. We would have an understanding of the potential effects on A1C and weight loss. Thank you very much for your attention.